Hello, my name's Humpert, and today I have a short little presentation on marijuana, and it's designed for parents with teenagers or parents with kids just a little bit younger who are worried about this stage, or even parents with children who are a little bit older, maybe in college, and are worried about some of these things. You may have heard that marijuana is a gateway drug. This is a very controversial topic among researchers, but it is unlikely that marijuana is the principal cause of further drug use. It is usually one of the first available drugs, so it is true that we see a pattern typically that individuals will try marijuana and then go to harder drugs. However, marijuana is more readily accessible, so that causation is can't really be drawn. And then it's also more likely that individuals predisposed to drug use will use marijuana and harder drugs. So that's to say that individuals who will use harder drugs will likely use marijuana first, just because it's more readily accessible, but because they're predisposed to drugs, they will use both. And this can happen from peer groups, family relationships, social class, and age of first use. So if peer groups are using these drugs, or in the family relationships, they're being exposed to these drugs, those are all increasing the chances that a substance use disorder will occur in that individual. So if it's not a gateway drug, why do you actually not want your child smoking? So there are a few things that have been shown. One is an amotivational syndrome, which claims that heavy marijuana use can cause lack of motivation and productivity. This is also a controversial syndrome or theory of something that can happen, because not all heavy marijuana users will have something like this happen. So it's very individualized. Another thing, heavy marijuana use has been shown to impair critical thinking skills associated with attention, memory, and learning. And all of these things are more important in the developmental stages, like the teen years. So that's very important. And then chronic use can impair lung capacity and increase chances of lung cancer. There were some other theories of negative side effects of using marijuana, like chromosomal damage, but a lot of these other things have been disproven other than the lung capacity. So there was a study for vaporized products, nicotine and THC, that have been 2,290 lung injuries and 47 deaths. And then like previous information out of like a 500 person study, 77% was using THC products and 16% was only nicotine. So it is a little unclear if it's coming from the THC or the nicotine. Also, good to put in here, THC is the part in the marijuana that will cause some of the individualized effects and what people call the high. And then also what can be present is the CBD, which is typically known as like the medical side and the relaxation and that. But anyways, for these injuries, most were popcorn lung, which is where tiny airways are inflamed. And keep in mind, this is for chronic use, so it wouldn't really be for beginner users or first-time users. And then after alcohol, cannabis is the leading detected drug in a driver after a crash. So it does still impair drivers, and it is illegal to drive under the influence. And you really don't want your young adult exposed to that, especially because their decision-making skills are not fully developed yet. So what makes someone predisposed to drug use? We talked about this a little bit before, but genetic vulnerabilities, trauma, stress, biological conditions, anxiety, PTSD, depression, exposure to drugs, other addicts in the family, social isolation, all of these things can contribute, and a lot of times, marijuana can numb some of the feelings like anxiety and depression, and medicinally sometimes they are used to treat those, but when it's not led by a doctor or a medical professional, it can lead to a substance use disorder very quickly, especially in young adults. And then comorbidity is a condition when two or more illnesses occur at the same time in the same person simultaneously or sequentially, which means at the same time or one after the other, and the interactions of those illnesses. So causal relationships between those illnesses are very hard to differentiate if there are any, but it's very common to see things like this. For example, maybe someone that has a generalized anxiety disorder and has a substance use disorder. That's very common. So if your teenager is struggling with other mental illnesses or trauma and stress, it's important to be checking in. So terms to look out for, because there's always new slang, and as a parent, it's hard to keep up with everything that the kids are talking about. So sativa, indica, hybrid, and ruderalis, these are species of marijuana and are known for producing different effects in the individual. Then some slang terms, Mary Jane, weed, hash, and hit the hay are slang terms for marijuana. Hit the hay is more active, like smoking marijuana, instead of the other three, Mary Jane, weed, and hash, which are just marijuana itself. And then the next three are a little more serious. It's A-bomb, Buddha, and Zoom. A-bomb is a marijuana cigarette with heroin or opium. Buddha is a potent marijuana with opium, and Zoom is marijuana laced with PCP. So if you're hearing some of these things that your children are talking about in these contexts, this might be a little bit more concerning to look out for, because it's already into the harder drug realm and shows that clear understanding of the drugs. So okay, how does your child feel? So data from 2022 shows how 8th, 10th, and 12th graders feel about given statements. It's important to check in with your child and treat them as an individual, and don't assume based off of any given statistics how your child might feel about drug use. So disapproving of using marijuana regularly, 8th through 12th graders, they less and less as they get older disapprove of using marijuana regularly, and then perceiving great risk in using marijuana is greatly decreased for 12th graders. Only 28% perceive great risk in using marijuana. And then trends in perceived availability, there was only data for 12th graders, but 71% said it would be easy to get. So if you have 12th graders or even younger kids and you think that they might not have access to it, they probably do. This is a quick rundown of what you might look out for if you're suspicious of your child. So for behaviors, eating binges outside of the norm, excessive laughter, fast or slow rate of speech, drowsiness, reddening of the whites of the eyes, excessive use of incense or breath fresheners. And then items, joints, secretive storage containers, lighters, rolling papers or pipes, a grinder, or empty plastic baggies that have like a tarnish brown hue. Here are some images of the grinder and the joints that we talked about in the last slide. And here are my sources. I did use the book and then a variety of other resources.